Okay, for central line catheter sampling, ideally we would be using the brown port for blood sampling. Unfortunately, the brown port in this patient is no longer patent. Oftentimes you can utilize your other ports to sample from, and you'll still use the 3-syringe technique. Anytime that you're not utilizing one of your ports, they do need to be clamped off though. That helps prevent blood flow back into the line to cause it to clot to become unpatent. So for this baby, our middle port is still patent. So what I'm gonna do, I'm just going to unclamp this port, and it has a cap, a bivalve cap on it, so it won't start bleeding anywhere. We have our heparin saline. I have pre-drawn up my syringes. You drop 2 mils of your heparinized saline. You're going to take that syringe with the 2 mils, attach it to your port, administer 1 ml of the 2 mls of heparinized saline, and then you're going to aspirate back. This is going to be your dirty sample. Dirty sample, it's not really dirty, but it does have heparin in it. Sometimes if it's positional, you can redirect the patient's head. As you see, it's flowing much better now with his nose up. And what you'll do, you'll detach that. You have your needle in your hand, you'll recap it. I like to give it a little rock, it does help. Take your blank syringe. I have a small one only because I'm only drawing a blood sugar for this patient. If you need a more of a large blood sample, you can use another 3 ml syringe. You attach your syringe to your port, draw your sample. I usually just set my sample to the side. Take your dirty sample that has your heparinized saline in it. You're going to reattach it back to your port. You're going to slowly give it back to the patient. This blood will not clot because it has the heparinized saline in it, but we want to make sure we're returning our sample to our patient unless something happens, as if you maybe drop the syringe or it becomes actually dirty by touching the bedding or the table. That way your patient does not become anemic from excessive sampling. Then I take 1/2 of a ml, 0.5 mLs of hep saline, and flush the remainder of that blood back into the patient. And then after that, I just clamp my line back off. How do you feel about that?